So there are different types of debridement. Is it clear? Every time that you find that the wound is infected, you need to debride. And now, debridement is a surgical procedure done by a surgeon. It is a surgical procedure. That's the definition of debridement. Surgical procedure done by a surgeon in order to remove the devitalized tissues. Is it clear? To remove the devitalized tissues or an ulcer. Is it clear? To remove the devitalized and the dead tissue of an ulcer. You do that all in the inflammatory phase, because the dead tissues are the one that are going to promote again the bacterial infections. We need to remove the devitalized tissue. So every time that you have an ulcer, you need also to first start, before going to the wound dressing, you have to first start with the debridement. Even if the ulcer is not infected, you need to remove the dead tissues, because the dead tissues are the one that are going to impair the growth of the living tissues. So after that, having the definition, you need to know that there are different types of debridement. The first debridement type that you have surgical debridement. In surgical debridement, you use the blade. The surgeon is going to go to the theater with an anesthesia and is going to use a blade in order to remove the devitalized tissue. That is the surgical debridement technique. Second debridement is chemical debridement technique. In chemical debridement technique, what you do is that you use certain chemical products which are going to be helpful in debriding the tissues. As an example, you have hydrogen peroxide. Is it clear? Hydrogen peroxide is one product that is used in order to remove the devitalized tissue and also help to perfuse the tissue with oxygen, and also promote it's going to promote hemostasis. So that's the good use of hydrogen peroxide. So those are the three main uses. It's going to remove the devitalized tissue in debridement. The second is that it's going to perfuse the tissue with oxygen, and then the third one is that it's going to promote hemostasis. Those are the good functions of hydrogen peroxide. Another one, we have sodium hypochlorite. Is it clear? You have hypertonic sodium chloride. It's hypertonic sodium chloride. You have hypertonic sodium chloride, which is also going to be debriding chemical product. The next one, you have sodium hypochlorite. The sodium hypochlorite, and sodium hypochlorite, the brand name is going to be Dakan. Is it clear? It's another chemical debriding product. So those are chemical debriding products that we have. The next one, the third chemical debriding product that you can use is going to be enzymes. You have enzymes like hyaluronidase. Is it clear? Enzymes like hyaluronidase, like keratanase. Is it clear? So those enzymes are capable of they are flesh eating. Is it clear? They can capable of eating the dead tissues. Is it clear? Example, you have hyaluronidase. The fourth one, after the enzymes, you have now a fourth one now, which is going to be biological wound healing, wound dressing. Is it clear? And in biological wound dressing, you have elements like worms. You have elements like larvae. Is it clear? So there are larvae of certain species of insects which are also biological products which can be helpful in order to debride structures. Is it clear? So there are biological products that can be helpful in order to debriding structures. Those larvae, they can feed on the necrotic tissues, and when they feed on the necrotic tissue, they can debride the structure. Is it clear? So generally, and also under the biological, we can speak of honey, but I'm going to speak about honey again in the another aspect. So particularly in the debridement of biological, we have larvae of certain insects, is it clear, which can be helpful. So that is what is going to be spoken on the debriding and the debriding technique which are being done. Is it clear? Now, you need to know that what the debridement is the first thing that you need to do in every patient that presents with a chronic wound healing. Is it clear? When you have a chronic leg ulcer, an ulcer that is already more than 2 months, debridement is the first thing that needs to be done. Is it clear? Even if you don't yet know the origin of the ulcer, you need first to do debridement. Origin may be infectious, it may be malignant, but just debridement, as we have said, is a surgical technique done by a surgeon in order to remove the devitalized tissue and also to reperfuse the vitalized tissues. Is it clear? So that's why you need to do debridement. Debridement is not only done in case of infected ulcer. But now you may be afraid to debride ulcers which are malignant. Is it clear? Why? Because malignant ulcers have malignant cells and they may proliferate, they may metastasize during debridement. Is it clear? So those are the only types of debridement. Those are the only cases where you have debridement may be contraindicated. In case of malignant ulcer, that may metastasize. Apart from that, other types you need to debride. Now, the next thing after debridement that you have to speak about, we are now to go back again to speak about the wound healing techniques, the wound dressing techniques.